hospital, I have seen very serious scars, so I'll always scared
Correct.
to
Better take
manipulate.
precaution.
Yeah,
Better do
yeah.
precaution.
There's always
Yeah,
precaution, and we should do under always general anesthesia. That I
correct.
prefer
Correct.
with
Correct.
the amount of blood at my disposal.
Absolutely. Absolutely.
Mm.
Can we use carbetocin in case of Rh negative mothers?
No problem.
No problem.
No problem. Because whatever we are doing, we have to give
Same thing.
NTD
Yeah.
and Avticon.
Same thing you have
And
to get.
even antenatal is also we are giving NTD.
And this could be a very important advantage because in the interiors we know how, I mean, difficult to get blood also at that time
Yeah, yeah.
with Rh
And
negative. Yeah.
Prashant sir,
Yes, sir.
there is our anesthetic is also with us. He's
Okay. Hello,
Dr.
sir.
Satyanarayan, senior
Hello,
anesthetic.
sir.
Sir, sir.
Hello, sir.
Hello. Hello.
Yeah.
It is wonderful listening to experience of doctors practicing. Finally, I mean, our knowledge is more theoretical, but in getting doctors' experience for our own doctors is more relevant.
Because we are very in small city.
Yeah. Sir, finally कसं असतं ना की your use will give confidence to the doctors, practicing doctors. I mean,
Yeah, yeah.
पुस्तकं आहेत, टेक्स्टबुक्स आहेत, पण एक्सपिरियन्स हा एक्सपिरियन्स असतो ना शेवटला.
Experience आणि
हां.
आमच्याकडे somehow we are lucky because we have got very competent anesthetic.
Absolute.
And with this our small setup, they are ready to help us.
That is very important, na?
That is very important.
Very important.
Mm.
Can a doctor use carbetocin for prevention of PPH if oxytocin is used for labor induction?
Oxytocin we use.
Yeah, for labor induction वापरतो आपण, पण if oxytocin is used for labor induction, can you use carbetocin for prevention of PPH?
Yeah, definitely, no problem.
No problem.
Yeah, because oxytocin is very short life.
Correct.
Yeah.
So by that, how effect would have gone on the.
By that time effect has gone. Only thing, sometimes we face bradycardia with the carbetocin.
Oh, okay. Bradycardia.
Yeah.
How common is it?
Previously, it was not much common, but in this year, we are seeing a lot.
So, actually, the side effects of carbetocin and pitocin are same. There's not much of difference.
Not much of difference, sir.
Absolutely not much of difference.
And sir, as anesthetists, have you seen those ADH type of effects of, I mean, oxytocin, we have seen in case of prolonged.
No. Actually, pitocin infusion, there is ADH effect will be there.
Correct.
Only one single unit of 5 units of pitocin.
Correct.
Rather than carbetocin, usually it should be given, what recommendation is only 100 microgram given once, but subsequent it doesn't affect. So you have to switch over to other oxytocics.
Okay.
So one dose of oxytocics, I doubt very much.
There is no ADH.
Carbetocin,
There is no ADH.
And sir, with carbetocin, sir has experienced some bradycardia experience. Is there a drop or blood pressure or, I mean?
See, it is, pharmacologically, it is same as that of oxytocin.
Exactly.
Vasodilatation. Vasodilatation is there. So, if you give it very fast, some amount of vasodilatation and then blood pressure fall will be there.
Fluctuations will be there.
Compared to the reflex tachycardia should be there rather than sometimes bradycardia. And most of the time, being in a private practice, we combine the drugs of carbetocin with other prostaglandin or the oxytocin. So the effects is very difficult to find out.
Absolutely, and we cannot take risk because a PPH is a PPH.
As a freelancer in private, we cannot take risk.
And the government is very aggressive nowadays.
Absolutely. And you know what is the risk? The risk is final patient can lose life. It is that bad. Well, I remember I was in JJ I'm talking about the late 70s, JJ Hospital, Mumbai. And at that time, we had only oxytocin and methergine. Methergine was also a luxury. My God, and we had PPH and then the whole hospital was there in the room. I mean, it is that...
at that time, we can't do anything.
Can't do. The patient was sinking in front of our eyes. Fortunately, she was saved. That was by the grace of God, In which cases, you have already answered this, you prefer IM over, in case of normal delivery, you prefer IM, whereas in case of cesarean, with the help of anesthetist, you use IV. And sir, IV you use in the drip, you said, no?
Yeah. Yes. Infusion.
Either you can use it in infusion sometimes, or I use it directly. Directly also, slow directly is you can give it.
Direct also.
So intramuscular, we have not tried it.
And direct when you give, sir, is the effect slightly
Slowly.
earlier?
Directly, slow.
No.
It takes a few minutes.
Yeah. But then is the effect slightly faster as compared to the drip or infusion?
Yeah, see, 100 ml or 50 ml, you put it and push it fast, it is as good as giving the
Okay, correct.
one
That's
thing.
correct. That's correct.
See,
That's correct.
See, we cannot wait. Suppose 100 ml, you put it, wait for 15 minutes,
No,
slowly go. By the time PPS starts,
Arre
it is,
Baba.
it is
Correct.
used as a
SOS.
prevention of a postpartum hemorrhage, rather than the treating the postpartum
Correct.
hemorrhage.
Very correct, sir. Very
That
correct.
is the one thing. It is the
Very
prevention. Because the receptors are less only.
Correct.
Oxytocin receptors are
And
there.
by then they would get fatigued after some time.
Yeah. This uterine fertility that.
We
Is there
accept
any-
a little side effects rather than the PPH.
Correct.
We welcome side effects rather than PPH.
In fact, PPH is one case we really like to discuss, but not see any patient.
Yeah.
Well, that's what I said, no.
It is a nightmare for the gynecologist.
We prefer
And-
side effects of the drug rather than the PPH.
Very well said, sir. And you
Yeah.
know what? It is in our this thing settings. Expect unexpected is always the way of life. A patient is normally suddenly she lands into some complications, and we cannot anticipate also.
We cannot do anticipates. Yeah.
Yeah. And sir, deadly complication. I mean, you have said about bradycardia and little fluctuation.
But I have not observed any
Any
deadly
deadly
complications.
complication.
No.
Good.
No deadly complications.
If the patient is not responding adequately with carbetocin, what other uterodynamics you would use in your order of preference?
See, I personally am practicing in the last 42 years. I still use methotrexate.
Correct.
Ergot, I still use it. I accept the side effects of methotrexate as my advantage actually. Because being an alpha agonist, I require, so it maintains the blood pressure for me. Except in pH and hypertensive patient, I don't use it.
Correct.
But other patient, I use it regularly. I use it. And next is, of course, I start with the pitocin drip, 40 units, almost 100 ml per hour, 40 units, slowly drip. And even then it doesn't stop me, then prostaglandin.
Yes. The prostaglandin has got that limitation of bronchial asthma and yes.
The limitation. But there also, once again, you have to take the advantage or disadvantage. Suppose, okay, bronchospasm accept compared to postpartum hemorrhage.
Yeah, anytime.
Like that. So
that's correct.
each and every patient, you have to weigh the advantage or the disadvantage. That's
you have to evaluate case by case. Correct.
Case by case, it differs.
Yes.
That's one thing.
And discussing theory is one thing and taking decision on the spot is an entirely different issue.
Yeah. It is entirely different. And a small setup again different thing.
Correct. What are the advantages of
Only
carbetocin?
advantage of carbetocin, the one thing over the pitocin is its duration of action is longer, so persistent tonic contractions.
Correct.
That is the only advantage. Otherwise, the same side effects, everything is same.
Yes, remains the same.
Everything is
And
same.
sir, possibly a single dose, and possibly you don't require a cold chain, especially in the areas in our country. Power goes everywhere. Power of, yes, that could be.
No. Yeah, that's the advantage. This is pitocin is a cold chain.
Exactly.
It's heat compatible. Carbetocin is heat compatible. That is the advantage over the pitocin. That is the only one thing positive.
Correct.
In our tropical country.
Yeah. And power outage happens everywhere. Even in Mumbai, we have power outages everywhere. Yes. Should carbetocin be kept as a reserve drug or it should be a first line?
I prefer first line.
Obviously, the condition is such that we can't have the luxury of a reserve drug. Sarah said very rightly.
No, rather than I put it in the availability. Availability, what is available, that is important for us.
Absolutely. That's correct. It is someone says, that if carbetocin fails, other drugs don't help. Is it true? Or this is just a myth?
Yeah, carbetocin, no. What happens? No, suppose elective cesarean section, you are doing it. Already the receptors are less compared to the labor patient. Suppose you give one dose of this one, it doesn't act much about this. So you have to switch over to other drug. It doesn't act. So we have to switch over to either ergot or prostaglandin or this one. Or infusion drip, we have to continuously put it.
If the drug doesn't work, yes.
We have to do it. We have to sometimes multi-drugs, we have to use it.
Yeah, correct. I mean, you have answered this, I will not. To conclude, what is your overall experience of using Carbetocin? Take home message for the audience.
Carbetocin is a safer option, and in proper condition, we should use it as a first choice of the uterotonics. This is the thing,
Correct.
and you can handle it very easily. Only thing, you don't repeat it. There is no use after
Correct.
it. Yeah, you have to change your ergometrics.
That's right. You have to take your own call.
Yeah.
Sir, thank you so much. It was lovely. I mean, the experience sharing is more important than actual facts and discussion on the drug. Experience is experience. There is this wisdom, no experience.
And already I was telling you, very small our town.
Correct,
Now
correct.
now it is grown up. But initially, when we were practicing in 90s, it's very horrible thing.
Yeah.
Even where there is no light in the theater and there is
I
peepage,
know.
what to do?
I was in Palghar for some years in
Okay.
1970s
Yeah.
and late 70s, 80s. I know,
Yeah.
Bapre. In torch, you have done that, that
This is-
big torch.
that was for routine for our
Yes.
periphery when we work in periphery of the
Exactly,
H1.
exactly.
The same thing.
First greatest challenge was to get help. That man will not be there. That all these things, sir, what happened. In Palghar, we have experienced all this.
Yeah.
Anyway, thank you so much, sir. It was lovely
Okay.
interacting with you all, and really coming to life with the realities. And I'm sure the
Yeah.
audience has benefited out of this. Thanks for taking time.
Okay.
Thank you, all
Okay.
the audience,
Thank you,
for
sir.
taking time from the busy schedule on a Saturday afternoon and attending this. Thanks, marketing and sales team of Hitro, for a super coordination. And
Yeah.
thanks, IT team, for your support. Thanks
Okay.
once
Thank
again,
you.
sir. Thank you so much.
Okay.
It was a
Bye.
pleasure.
Bye.
It was a pleasure.
Bye.
We'll meet
Bye.
again. Thank you, sir. Thanks, Bivas. Thanks, Nagadevi.
Okay. Bye.
Bye.
Bye, sir. Happy weekend.
Thank you. Wish you the
Thank you
same.
so much.